So House Bill of 4528 is emergency health care workers who are affected by things like PTSD, depression, substance abuse, due to difficult nature of their work, according to a 2014 study done by the National Health Institute. It is important to ensure that those individuals that are essential for providing health care services, who we rely on in an emergency, to have access to appropriate, non-punitive substance abuse treatment and mental health care. Substance abuse, especially opioid abuse, is on the rise throughout the state, especially in my county, Macomb County. And many emergency medical professionals work on a voluntary basis and are difficult to recruit. There is actually a shortage of emergency medical professionals here in the state. So we certainly can't afford to be terminating or delicensing emergency medical professionals. House Bill 4528 amends multiple sections of the Public Health Code, makes eligible emergency medical service personnel as defined under Section 17 of the Public Health Code for the Health Professional Recovery Program, or otherwise known as HPRP. Emergency medical service professional means medical first responder, emergency medical technician, emergency medical technician specialist, and paramedic or emergency medical services instructor coordinator. There are 29,000 additional persons that would be eligible to participate should this bill pass. A little bit about the program. It was established in 1993 to provide a confidential and non-disciplinary approach to address substance abuse and mental health issues. It encourages health professionals to seek recovery before their condition harms a patient or negatively impacts their career. It is a monitoring program, not a treatment program. There are 24 professions already covered under the program. They're covered under Article 15 of the Public Health Code. And some of these professions that are already covered are dietetics and nutrition, acupuncturist, and massage therapist. There are approximately 749 professionals a year that take advantage of this program. Under existing law, if a profession isn't covered under the program and job impairment is suspected, an individual is referred to LARA, where they could lose their job and license. According to DHHS, 15 emergency medical professionals lost their license last year. The Health Recovery Program has 5 steps: intake, referral, treatment, monitoring agreement, and completion. The cost of the program, LARA has already agreed to a 3-year contract, which doesn't expire until October 31st of 2020 with a company by the name of Uliance. The contract value is just under $6.4 million. The money is generated through licensing fees deposited by the Health Professionals Regulatory Fund. Treatment is paid for by the individual's insurance or out of pocket. There may be additional administrative costs to DHHS if they become responsible for the EMP's aspect of the program. DHHS can enter into a consent agreement with LARA to administer the program to mitigate costs. The benefits, and to wrap this up, to the program are helping workers that make their living helping others get the treatment they need for substance abuse and mental health issues. It helps ensure that patients receive necessary services and avoid injury. The individual is given a choice to receive treatment, and there are no additional costs for the program. It already exists, and the state has already paid for it.